Well, many factors can contribute to your heart's health, but did you know that some of those factors include where you live, work, and play? Yeah, they do. And joining us to explain are Dr. Ronnie Whitfield, aka the Hip Hop Doc, and American Heart Association Celebrity Ambassador Shanti Das. Appreciate you guys joining us. All right, so what are the social determinants of health? What is that?
You know, Curtis, the social determinants of health are circumstances where people are born, where they grow, live, work, and age. And they are basically molded and shaped by the resources in the community, the money, the resources. And you have to look at things like heart disease and stroke. How would that social determinants impact those things? We know that people that live in lower economic statuses have higher rates of heart disease and stroke. We know that people that have lower levels of education also have higher rates of heart disease and stroke. And that's very important when, as a physician, when I recommend a patient get a medication for their blood pressure, cholesterol. Can they afford the medication? Do they have access to get to the doctor? And even with expanding coverage with the Affordable Care Act to 20 million people, just having insurance is not enough. There's more to treating a patient than just having insurance.
Well, let's talk about the impact they have on heart health, stroke, and high blood pressure.
Well, again, where you live matters. What you eat matters. So if you don't have access to healthy food and can't get to the grocery store because it's too far from where you live, that impacts how you live, and that impacts heart disease and stroke. And again, as I said earlier, individuals that have low economic, socioeconomic status have more incidences of heart disease and stroke. Those that have lower levels of education as well. Public housing, you know, living in affordable housing and being able to afford to your water supply and to keep the lights on, all those things impact heart disease and stroke, particularly in communities of poverty-stricken areas.
Yeah, it's a pressing issue in a lot of our communities, the food desert areas. You know, if people live in those areas or there's people outside of those areas who want to help people in those areas, what are the steps we got to take to start changing this?
The first thing you can do is you can head on over to www.empowertoserve.org. I know there's so many people that are out there living in food deserts. I myself grew up in Atlanta, Georgia. We had to drive 5 miles, sometimes 10 miles, just to get to a good grocery store. And of course, on that drive to the grocery store, you know, we were passing by all of these fast food restaurants. And that's what we're really trying to do, is to get people to mobilize, to get active, get in the communities so we can help to shape policy and to really create a healthier lifestyle in our urban communities.
Right.
Well, then let's do that. Let's tell our viewers how they can get involved and how they can help out and where they can go for more information.
You guys can go right on over to www.empowertoserve.org. Get your family members, your squad, your team, co-workers, people in the church and your community, and really come together and set some goals for yourself and get active.
We'd like to thank American Heart Association for making that segment possible.